So first of all, did any questions come up for you guys about the first session, the first lecture that we did? We did a little bit of an overview of the first, second, and third trimesters. We took a look at what's happening with changes in the mom's body, also what's happening with baby's development over those trimesters. And then we finished off very specifically looking at some pelvic floor work. So the pelvic floor work for a lot of women, and during pregnancy and post-pregnancy, is sort of one of the big issues that could arise. So that's why we actually pay a lot of attention to it. So again, just a little bit of a recap is that the pelvic floor, it's designed to close, but it's also designed to lift. So almost like defying gravity. So it's that feeling of actually supporting the uterus. So when you're pregnant, supporting the weight of the baby as well as all of your internal organs. Release and relax or bring energy to wake again to the pelvic floor is, and for a lot of women, if you've had natural childbirth, you're going to have some damage floor. So just ensure that even working with an image and make the pelvic Guys, is everyone back?
Yep.
Yay.
Yes.
I had a lovely fat chat with myself when he was frozen. All right, so I've switched my Wi-Fi network, so hopefully this is going to actually be a little bit more stable now. So what I was talking about is that obviously the pelvic floor is a big focus during pregnancy and postnatally. So during pregnancy, making sure that the pelvic floor stays strong, but also being able to release the pelvic floor in order to get baby out if you're having natural childbirth. But then postnatally, post-pregnancy as well, if there's been any damage done to the pelvic floor. So it could be just from natural childbirth, the stretching, or any kind of micro tearing of those fibers, because don't forget that the pelvic floor is skeletal muscle. And then also if you have had an episiotomy, and remember in that one video we watched that oftentimes there is like, they'll do a little nick, a little slice, either straight down towards the anus, which is through the perineum, or slightly off to the side, and it's basically to create a larger opening for the baby to come through, and it makes it easier to stitch up if it's a smooth cut. So that's an episiotomy, but you know, there's going to be scar tissue there as well. So, you know, sort of reconnecting to the pelvic floor can be quite a challenge postnatally. So even if you're starting with imagery, it's the best thing to do is just to start those connections again as soon as possible. So part of your homework was to practice teaching pelvic floor to someone else? Did you guys have an opportunity to do that? Yeah? And how did it go? How did you,
Yeah.
cueing that you tried? Did you come up with some interesting
That's correct.
stuff? Felt comfortable with?
Yeah, I loved it. It was so interesting also to do a bit of research beforehand to find out a little bit more about the pelvic floor before teaching it, so that I felt a bit more confident about how to convey it, and finding out amazing stuff about the pelvic floor. You know, because it's really, I mean, if I didn't know that the pelvic floor was so integral to not only pregnant or postnatal, but just generally, men also have pelvic floors, but just generally to our health.
Yeah.
It's amazing. And then as you read about it and learn more about the pelvic floor, how it's connected to your jaw fascia, and how the pelvic area is like a bowl for holding emotions and anxieties, how it's connected to the Muladhara chakra. So it was a whole journey for me. Amazing.
Yeah, and you know, the pelvic floor is incredibly complex, you know, and it forms all of these other systems. It's basically, if you take a look at the fascial lines, it's part of what's called the deep front line of fascia, or the deep midline. It's essentially our core. So it comes from the inner thighs up to the pelvic floor. It comes around our organs up to the diaphragm, and then it runs up through into those deep neck flexor muscles. So it's all connected as part of our deep fascia, and in Pilates, what we call our core unit. So it's very difficult to separate out the pelvic floor just as its own little thing, because it's integral to everything else working properly, right? And connecting it into the yogic philosophy, what they consider all the different chakras, right? And this is your lowest chakra, it's your root chakra. So it's quite interesting, you know, whatever philosophy you want to look at, you know, how it ties in, like you say, quite an integral way. And it's also why you have pelvic function specialists, like I keep talking about Karina Avni, you know, that's her whole area of specialization, you know, so it is very, very intricate as well.
Yeah.
Cool. Awesome.
So just one thing that I discovered actually is that because I asked some of the people that are teaching classes whether they wanted to come and do it for me as my homework. So there were 3 ladies that came and we did it on Zoom. And I learned from you how to use that little picture thing that I didn't know before, so that I could pop up a little photograph of how the muscles all work, so I could explain to them what I'm doing. And then I realized after listening to 2 of the ladies beforehand that actually they suffer from tight pelvic floor. And so it's like a permanently tight from stress, and they actually don't need to engage the pelvic floor, they need to learn to relax it. And so that was interesting, because I hadn't considered actually that there's that. And the pregnant lady giving birth today, actually, looking now, Friday, she's giving birth today. She was saying that she needs to learn to relax the pelvic floor so that she can let the baby out. So we actually did more of that than engaging. It was interesting.
Yeah, so I mean, and it's great that you actually had that interaction with your clients and that they were comfortable to tell you that too, because we actually don't consider that's going to be a problem. Like you kind of think, ooh, most people, weak pelvic floors, but you actually get a condition called vaginismus, where basically the pelvic floor kind of goes into a spasm and it's constantly tight. And so, you know, for a lot of women, it actually causes all kinds of issues like constipation, like bladder infections. So if it's really difficult for you to be able to let go and go to the toilet, you sometimes see it in certain athletes, like professional dancers, for example, where it's incredibly tight and they hold on too much, and being able to let go is a problem. And obviously then it's going to be an issue having a baby. And it's also very painful for those women to have intercourse as well. So, you know, it's an issue that we don't really think exists, but it's out there, you know, and so that softening and releasing of the pelvic floor is so important as well. And also that tightening of the pelvic floor, because if you think about just exactly what Maya was talking about now, is if you think about your pelvis is basically a basin, right? It's a basin that holds everything inside. So, you know, you've got your bladder, you've got your uterus that sits inside, that's normally the size of a fist or size of a grapefruit, and it's basically suspended inside the pelvic floor with all of these ligaments, like connective tissue as well. So if there's any kind of issue with the pelvic floor, what you find is that the ligaments that attach to the pelvic basin can start to almost contract or pull, and then all of a sudden, women are maybe getting sore lower backs, or maybe the sacroiliac joint is painful, or maybe the SIJ is getting pulled out of place. And then what you realize is that it might be one side or one section of the pelvic floor that's actually tightening or pulling. And again, this is where manual therapy is invaluable. So it's not necessarily something that we're able to do as movement therapists, besides referring them on to someone like Karina, who can actually do an internal massage, an internal fascial release. And all of a sudden back pain is released, sacroiliac joint issues are alleviated, you know, so I mean, it's quite amazing that you can actually go have these two completely different issues of like that weak pelvic floor or that really hypertonic pelvic floor, and there's problems that go along with both of them, right? Okay, did I give you guys Karina's number earlier? Did I give that to you on the last one? I'm going to put Karina's details here. Karina Avni, she's a pelvic function physio, and she's based at Lavender House at Kingsbury Hospital. And she is just a wealth of information, and I've got her office number here. So if you ever needed to refer someone to her, sorry, I'm just getting her number for you. Okay, so it's 683-1174. So definitely a worthwhile contact.
Thanks.
All right, great. Okay, so guys, we're going to continue moving through our manual. I'm going to do a little screen share with you. So this is in our manual on page 11. So on Tuesday, we finished off here talking about the pelvic floor. You guys went away with a little bit of homework to kind of explore the cueing that you might use, how it felt for clients, etc. And just continuing on with talking about pelvic floor is that one of the training techniques that some people use or they advocate is getting clients to stop themselves from urinating mid-flow. And it's definitely not a good idea. You're inhibiting the bladder from emptying completely. So, you know, one of the cues that I tell people is, I will not wee, but it's an image. I'm not actually getting them to physically do it. Or I'll say, imagine that you stop yourself from urinating mid-flow. It's an image. I'm not actually getting them to do it. So basically how that works, and I think we did speak about this the other day, is that you've got your bladder here and you've got your pelvic floor here that is supporting you. Cool, so Grace, I'm going to talk about that now as well. So if you've got your bladder at the beginning of the day and it's not full, and then you have a cup of tea and you have a couple of glasses of water, maybe you have a coffee, and your bladder starts to fill and your pelvic floor has to support from underneath. It stops you from weeing, okay? And typically women have about a capacity of 400, 450 mils to hold in their bladder. That's sort of an average bladder. And then off you go to the toilet. And as you sit down, your brain goes, great, I'm at the loo, it's okay for me to wee. So your pelvic floor relaxes, and then the bladder is able to empty and you have a nice big wee, okay? But now, what happens? Off you go to the loo, you sit down, your pelvic floor softens and releases, you start to wee, and then you say to yourself, stop yourself from weeing and just check that you can use your pelvic floor. Chip. Pelvic floor kicks in, bladder stops emptying, but the bladder isn't empty yet. Then you go, okay, cool, now I can continue weeing. So you relax the pelvic floor, the bladder empties some more, and then you go, oh, I'm going to use it as a training method, and I'm going to stop myself from weeing, okay? And then the bladder goes, oh, okay. And then the brain's getting this message saying, oh, I guess I'm not actually supposed to completely empty. So now you kind of think, okay, now I'm done, and off you go, bladder isn't empty yet, and 20 minutes later, you need to go to the toilet again. And then you're kind of going, and so you're getting into this pattern of not allowing the bladder to empty completely. And it's going to cause all kinds of issues that you're going to feel like you need to run to the toilet every half an hour, every hour, okay? And you might start to cause all kinds of irritations, for example, where you maybe get bladder infections, that sort of thing as well. So it's not a great training technique to stop yourself from urinating mid-flow. All right, does that make sense, guys? Yeah? All right. Cool. Okay, so Grace has also asked, how would you teach TA activation to someone with diastases? So guys, diastases recti is going to be a big topic that we talk about in this course. So we're going to talk about all of that in one go and how we would deal with it, because we want to look at what is diastases, what are the implications of it, how would you work around it, how would you help fix it, basically. Okay, so we're going to talk about that as an entire subject. Okay, so let's go back to our manual here. So not everyone has a natural childbirth. So I had a cesarean section with my daughter Ella. So you're going to deal with women that have had natural childbirth and very possibly pelvic floor issues or other issues coming along with that. And you're going to deal with quite a few women that have cesarean sections, and then there are different consequences perhaps that go along with that. So oftentimes with a cesarean section, the scar is actually quite low down, like really low down near the pubic bone. So sometimes, especially quite recently after the surgery, you've still got the stitches in, you've got a bit of micropore tape that's over that scar that's helping to hold it together and make it feel secure. But oftentimes if you're laughing, coughing, sneezing, you might feel that it's a very vulnerable, weak area. So what a lot of women are taught when you have a cesarean section is that if you need to sneeze or cough, you literally place one hand under the scar, one hand above the scar, and you literally just kind of hold it together so that if you're going okay, and coughing, you feel that you're actually not putting any outward pressure on that scar. So, you know, it does feel like it's maybe just in the first few weeks after surgery. So I think I had my stitches taken out probably about 10 days afterwards, okay, was pulled out. I kept the micropore tape on there. It didn't feel like an overly weak area for me at that point. So I wasn't too concerned, but you know, other women react very differently during pregnancy. So, but now for other women, that if you're experiencing any kind of continence, so this is usually with natural childbirth, but quite frankly, it could be from a cesarean section delivery as well, you know, that you just have not maintained pelvic floor strength during pregnancy with the weight of the baby on the pelvic floor and on the bladder. So you could experience incontinence for any number of reasons. And there, a quick fix solution is that you might actually see women do exactly what little kids do, right? So if you see little kids who need to go to the toilet, do you guys recognize this? Okay? So little kids will cross their legs over, and immediately I actually know, oops, do you need to go to the toilet? Yes, I do, and off you go, right? And you'll see that with women with incontinence, that if they need to sneeze, cough, maybe they need to go to the toilet, and one of the ways they can kind of like temporarily stop it is by crossing the legs. Now basically, what that does is it stimulates the pelvic floor. Because what you're actually doing is squeezing across the vagina, which is going to stimulate the pelvic floor, and that is going to help inhibit the bladder. So guys, it's not a long-term solution. I mean, you don't want to be doing that for the rest of your adult life now, is crossing your legs or holding the scar tissue together. So it's a temporary solution while you are actually working on pelvic floor as well, right? Yeah. Then I've put Karina's website there as well. She has a website called pelvicfunction.co.za if you want to go and check out any of her information. And just last of all, what I'd like to say is we have to remind ourselves that we are on a journey with our clients, maybe while they're trying to fall pregnant, during pregnancy, and then post-pregnancy. And our job is that we are teaching movement to our clients, right? So we're teaching yoga, we're teaching Pilates. Grace as well is a biokineticist, so you're going to be teaching more on the rehab side as well. But while we actually want to understand the mechanisms of natural delivery, the mechanisms of cesarean sections, what are the pros and the cons, it's actually not our place to really offer advice or judgment for clients on their decisions about the childbirth as well. And, you know, it's one of those fine lines where, you know, you might share your experience of, okay, well, this is what happened with me when I was pregnant, you know, and I chose to have natural, I chose to have a water birth at home, or I tried to have a water birth at home, it all went wrong, I had an emergency cesarean, you know, whatever it was that was your personal experience. I think that's always interesting to share, but at the end of the day, you want to step back and realize that you're actually there offering support to this person, and at the end of the day, you're offering movement systems, basically to help people along their path and their journey as well. So we sometimes need to step back and just remind ourselves of that. So guys, on yesterday's, let me just see here. So Maya's asking, in a movement class, can we use postures to activate the pelvic floor where the posture itself does the work of engaging or softening, or do you always need to do the conscious engagement? That's a really, really excellent question. So guys, there are going to be a lot of movements that we do that either switch on the front pelvic floor, switch on the back pelvic floor, naturally engage it, naturally soften it, okay? And it's wonderful to incorporate those because sometimes you don't even need to refer to the pelvic floor then. It's just going to naturally do what it does. So here's a perfect example, is that if you guys have ever seen what is called a yogic squat. So a yogic squat, you come down into this deep squat like this, okay? And it's called the garland pose. Guys, this is complete release of the pelvic floor. Complete release, okay? It's also one of the reasons why in some cultures, especially in Africa, this is how a lot of women will actually deliver baby, all right? Because it completely relaxes the pelvic floor. And then it's also one of the reasons why when you go to the toilet, that this is one of the better positions to go to the toilet in. Now maybe it's a bit uncomfortable, like on your hips or whatever, on your legs, especially if you've got knee issues. So what a lot of people advocate in Western society is if we're sitting on a toilet, that instead of having your feet on the ground, you actually put some books or like a little stool underneath your feet because it lifts your knees up above the height of your hips, which softens the pelvic floor. So it allows you to go to the toilet much more easily because you relax the pelvic floor as well. So doing postures like that will completely relax the pelvic floor. You don't even have to talk about it. And then also interestingly, if you went onto the mat and you guys know the pelvic tilt, for example. So guys, normally we do the pelvic tilt with the knees and the feet hip distance apart in parallel, right? And this is a wonderful way to activate the lower abs, release the lower back. It's very soothing on the lower back as well. But if you were to actually take the feet apart and let the knees collapse in, there is a reflexive connection to the front pelvic floor. Okay, so as soon as you change the, now I'm not going to cue the pelvic floor, but I might do pelvic tilts in this position with the knees together, and automatically the pelvic floor switches on. I don't have to talk about this. Or I could actually have my knees pointing out, I can touch my heels together or have them slightly apart, and that external rotation reflexively switches on the back pelvic floor. So I could do my pelvic tilts here. And I'm not going to talk about the back pelvic floor, but the simple placement of the body is going to switch it on. So you can actually do it consciously, where you'll maybe be in a resting position like we did on Tuesday, and we talked very consciously about the pelvic floor. Or we could be in a cat stretch position and we can speak very consciously about the pelvic floor, or you can integrate it and people don't even know that they're activating and releasing pelvic floor, and you just integrate it into their movements. Does that answer your question, Maya?
That's fantastic, Renee. Thanks. Yeah, brilliant.
Cool. Awesome. So I want to share a little video with you guys because on Tuesday, we took a look at the mechanism of natural childbirth. So I'm sure you guys remember that. So that the cervix gradually dilates, and at full dilation, it's about 10 centimeters. And the baby is going to be facing backwards. Then there's going to be a natural turn so that the shoulders can come out. And then baby is delivered. And then there's the last part of delivery where the placenta actually is contracted out as well. So that's the mechanism of natural childbirth. So obviously coming through the birth canal, and obviously going to be a big stretch on the pelvic floor and possibly having an episiotomy as well. So now let's take a look at the mechanism of, let me just find it here, of a cesarean section. So I just want to get the little video up. I want to pause it there. That's it, busy loading.
A cesarean section, often referred to as a C-section, is a surgical procedure in which incisions are made in a woman's abdomen and uterus to deliver a baby. Some cesarean sections are planned. More often, however, the need for the procedure becomes apparent after the onset of labor, when abnormal conditions make a vaginal delivery unsafe for the mother or her baby. Common indications for cesarean section include dystocia, placenta previa, and fetal distress. Dystocia, or prolonged non-progressive labor, can occur when the baby's head is unable to fit through the birth canal, or its body is in an unfavorable position, such as perpendicular to the birth canal or buttocks first, which is the breech position. Placenta previa occurs when a low-lying placenta partially or completely blocks the cervical opening. Fetal distress occurs whenever the health of the baby is in imminent danger, usually from inadequate blood flow through the placenta or umbilical cord. Fetal distress can occur when the placenta separates from the wall of the uterus prior to delivery, or the umbilical cord becomes compressed or squeezed. Other conditions that may require a cesarean section include multiple births, large tumors of the uterus, genital herpes or other infections, or medical problems such as uncontrolled diabetes or hypertension. Your doctor may use ultrasound testing and a fetal heart monitor to help decide whether your baby should be delivered by cesarean. When a cesarean section becomes necessary, you will be prepped for surgery. If not already in place, an intravenous line will be started, and a catheter will be inserted into your bladder to drain urine. In the operating room, you will be given anesthesia. In most cases, a spinal anesthetic is administered to numb the lower portion of your body. Sometimes, however, a general anesthetic will be used. Your doctor will begin by making an incision in your abdomen. It will either be a vertical incision from just below the navel to the top of the pubic bone, or more frequently, a horizontal incision across and just above the pubic bone. This is often called a bikini cut. Your doctor will then make a second incision on the lower part of the uterus. Once the uterus is opened, your doctor will rupture the amniotic sac if it is still intact and deliver the baby. The time from the initial abdominal incision to birth is typically 5 minutes. Your doctor will then clamp and cut the umbilical cord. Gently remove the placenta and tightly suture your uterus and abdomen. This typically takes about 45 minutes. The hospital stay after a cesarean section is usually 3 to 5 days. During this time, you will be encouraged to breastfeed, nap when the baby sleeps, and get out of bed often. While most patients are full recovery may take 6 to 8 weeks. Your scar will lighten as it heals.
Cool.
If you're an eye health professional,
All right. So cesarean section, obviously very different experience from the natural childbirth as well. So, and in the past, a lot of people thought you're going to cut through the abdominal muscles to actually deliver baby. And that's not quite accurate. So they will actually obviously cut through the skin. And guys, one of the biggest things that also happens as well is cutting through the fascia, through the connective tissue. So the very, very first layer of connective tissue we've got is directly underneath our skin. So as soon as you cut through the skin, you're going through that first layer of fascia. So that's the first bit of healing that you need to also take a look at as well. Then when they're actually taking baby out, remember guys that the abdominals, you've got 3 layers of abdominals. You've got your transverse abdominis is the deepest. It's not all the way around connected to the front. It's about 360 degrees. So there's this big gap around the front of your abdominals where the transverse actually becomes fascia. Okay, so again, they'll be going through the fascia, connective tissue of the TA in order to get to the uterus to pull baby out. And then the next layers of abdominals are the obliques. And again, the obliques do not actually connect across or to the midline with muscle fibers. They connect via fascia. So now you've got another layer of fascia that you're going through to get to the uterus. And then the most superficial abdominal muscles are the rectus abdominis. And remember that the rectus abdominis is like your 6-pack muscle. You've got a set on the right, a set on the left, and they are connected together by this thin line of fascia, which is where your belly button inserts, by the way. And that is called the linea alba, okay? And again, as baby's getting bigger, that linea alba is getting stretched apart anyway. So now the sheath, that fascia is very thin, and that's what they actually cut through, again, to get to the uterus. So they're not actually cutting through any kind of skeletal tissue. They're going all the way through connective tissue to be able to get to the uterus. So not to say that that's easier to mend. Oftentimes there are all those issues that come along with that as well. And that's what Grace was asking about earlier, is that diastases. And we're going to talk about that in some more detail. Okay, so with the cesarean, they're going to be cutting through all of that connective tissue. And then that's the healing that needs to take place, is that scar tissue coming back together, and then obviously the skin as well. Do you guys have any questions about cesarean sections, natural? Yeah? I mean, those videos are both, I think they're both very, give you a lot of information so you know exactly what's happening as well. Okay. So now I want to show you just one more video, and this is for the pelvic floor. So when we spoke about the pelvic floor on Tuesday, and then I got you guys to practice teaching the pelvic floor and finding a position that you can kind of think, okay, well, how would this apply to somebody in their first trimester or postnatally? So obviously, your body shape is very, very different as you come into the third trimester. So this video that I'm going to show you now actually just talks about the pelvic floor, and what's really lovely is that the woman who is in it, she is in her third trimester, she's got a very big tummy, and you can actually kind of see what's happening as she contracts the pelvic floor as well. So I'll show that to you now. So Grace is saying, random question, but why can't you birth the placenta first? So basically, depending on how long delivery takes, don't forget that all your oxygen, all your nutrients are coming through the umbilical cord from the placenta. So if the placenta starts to come out first, basically say goodbye to the oxygen supply for baby. And then you're kind of thinking, well, now baby had better get out like within the next few seconds to actually start breathing ambient air when you're born, right? So that's the reason that you want baby out first, because then they're actually still getting some from mom, plus they're breathing ambient air, and then when the placenta comes out and they've cut the cord, then you actually don't need that supply from mom anymore. Okay, cool, makes sense. All right, guys. So I'm going to show you our little pelvic floor information right here.
One specific exercise that is vital through pregnancy and after birth are pelvic floor exercises. A strong pelvic floor provides support to your growing baby, recovery after birth, and helps to prevent incontinence. The pelvic floor muscles are the bottom of our pelvis and surround the opening to your bladder, bowel, and the vagina. These muscles are more active when we do things like sneeze or lift something heavy. The pelvic floor releases and relaxes when we have bowel movements or when our baby is born. Pregnancy is a great time to learn how to activate your pelvic floor muscles for improved function in pregnancy and in the years ahead. Relax your shoulders. Focusing on your back passage, lift and squeeze upwards and inwards as though you are trying to avoid passing wind. Hold, and then release. Now, bring the pelvic floor lift forward to the front as though you are also trying to control the flow of urine. Hold, and then let go. You should feel your muscles release. Sometimes it helps to visualize this movement like a jellyfish swimming through the ocean. Squeeze, hold and lift. Release. Lift. And release. Once you have mastered activating and releasing the pelvic floor, you will notice a great improvement in activation of your pelvic floor muscles.
Cool. So, I mean, you can see just from squeezing pelvic floor that there was like quite a big pulling in of the belly, right? Baby got hugged in quite a bit, and that lifting upwards. So, and that was just coming from that internal connection. So, I mean, it just also draws your awareness and your attention to the fact that the pelvic floor is part of the core. And when you connect it, it's going to activate the transverse abdominis and it's going to activate the multifidus, which is why it's such an important connection for the lower back as well, because so many women struggle with lower back pain as they go through pregnancy and then the weight of the baby pulling forward as well. Cool. Guys, any questions? All good?
Sorry, if you don't mind, I always have so many questions.
Go for it.
I just want to ask you something. One of the ladies, I'm just checking her message to me afterwards. She said to me after we did that exercise with the pelvis, she said, do the lower tummy muscles also tighten when you do the exercises, or do you need to try and relax them? So I said to her that you should first try to isolate the pelvic floor muscles, to use those only, and then afterwards notice how the abdominal muscles and the legs and the gluteus and the breath all work together, but should all stay relaxed actually, although some of them engage. But I didn't know where that line is. Do you say to people you should only work with the pelvic floor, or is it completely automatic for the abdominal muscles also to work?
Yeah. So put it this way: if everything is working well together, yeah. So then what should happen is that there's almost this cascade pattern where one thing kicks in, which triggers another, which triggers another. So it's called a cascade. So it should be, if you activate front pelvic floor, that there's a reflexive connection to the transverse abdominis, okay? So they should actually tie in together. If you connect the back pelvic floor, that there should be this instinctive reflexive connection to the multifidus at the back, that deep back muscle. So when you squeeze the whole pelvic floor together, that's that feeling, remember you've got those horizontal fibers, when you squeeze that together, then the TA and the multifidus should connect. And then there's that connection of the breathing, the diaphragm, to the pelvic floor as well. So the breathing to that connection with the diaphragm, almost like a trampoline that they work together. But you could have a weak link. So you could be connecting the pelvic floor, but for whatever reason, if the transverse abdominis is a weak link, it may not kick in automatically. So then you may need to consciously and deliberately add the transverse abdominis, okay? Or the same thing with the multifidus. You could be squeezing the back pelvic floor, but maybe there's something going wrong with the multifidus. And then you might need to consciously and deliberately lengthen the spine, because that's going to start to switch on the multifidus. So in good patterns, it should all come in together. But if there are issues with any of those core unit muscles, then you've got to do some very specific strengthening work as well. Okay, Grace is asking, is it a problem if you cannot differentiate activation of the anterior and posterior passage? So technically, you should be able to differentiate. And the reason being that we have basically 3 different muscles that work at the pelvic floor, okay? So the first muscle is, let's say you're visualizing someone's pelvis while they're lying on the back, as if you're doing a gynecological exam. So lying on their back, here's the pubic bone, here's the tailbone. So you've got all the organs here, anus at the bottom, you're going to have the vaginal opening, and you're going to have the urethra up at the top, the ureter. Okay, so those are going to be the 3 openings for a woman. And then along the sides here, you've got the sides of the pelvic bone. So that's basically the birth canal, right? Okay, so let's say you're looking at a woman like this. So from the pubic bone, around the ureter and around the vagina, so it's like a longitudinal muscle, okay? That is the first muscle that controls I will not wee. So that is very specific. And then there's another muscle that goes all the way from the pubic bone around the ureter, around the vagina, and goes around the anus. So it's another longitudinal muscle, and that one is going to activate when you think, I will not pass wind. Which is why, if you think I will not pass wind, you often feel the front connecting as well. Okay, so that's the longer muscle. And then you've got the horizontal fibers. Let me put my hands out there. So you've got the horizontal fibers coming in this way. That's the feeling of closing, all right? That it draws those two pelvic bones towards each other. That's the sensation. So you should be able to differentiate. And if you can't, it's telling you that that first short longitudinal muscle at the front is probably not activating, or maybe there's an issue with the transverse abdominis connection, because those two are very closely connected. TA and front pelvic floor are very closely connected. Okay, Grace, does that answer your question? Is that cool? And again, you know, we're not doing manual insertion of fingers anywhere with our clients, right? We're movement therapists. So you might be getting information from your client saying, "Ooh, I don't really feel it." I then refer on to someone else who can go into details of figuring out, well, what's going on, and they can actually give some very specific feedback and cueing and manual release, perhaps, that's going to help people activate. Okay, so let's go back into our manual here. We already took a look at our pelvic floor exercises. We're going to talk about hyperpressives later. And let's go into a little bit about our breath work and why is breathing so important. So guys, breathing creates space, okay? It creates space in our bodies. It creates space mentally, gives us a mindset, and it gives us space to connect emotionally as well. And any kind of mindful movement, which is fabulous that we're in Pilates, yoga, but all kinds of disciplines like Tai Chi is such a beautiful movement method as well. Everything has breath as a thread. Okay, so it's a commonality that any of these mindful movements incorporate. So in Pilates, we encourage people to breathe in through the nose and out through the mouth. In yoga, you're encouraged to breathe in and out through the nose. And when you're going through pregnancy, encourage mom to use whichever breath feels right for her. There's no right or wrong. What it's really about is creating a connection to your body and giving yourself space to kind of like feel what's going on with you, physically and emotionally as well. You don't want to use any techniques that ask you to hold your breath, okay? So we've already got decreased blood pressure generally. You can get women with hypertension, but that's like an unusual thing, okay? So with the increased blood volume while you're pregnant, your blood pressure is going to drop, okay? So along with the fact that you're supplying baby with oxygen, plus ourselves with oxygen, we need to be able to breathe to our fullest capacity. We want to avoid any kind of fast breathing. So yoga, breathing is called pranayama, okay? And there are different kinds of breathing techniques that are used in yoga specifically. There's something called a fire breath or kapalabhati, which is literally, it's designed to increase energy. It's like a fire building breath, all right? I wouldn't recommend it during pregnancy unless you want to really see somebody pass out quickly, all right? So we stay away from any of that like really fast or quite hectic, almost like a hyperventilating as well, okay? So that's one of the techniques that we're going to avoid. And then, ideally, we want to be able to breathe easily as we move through the class. So ribs are going to be expanding, baby is pushing upwards. So this is a challenge now for a lot of women to breathe because there's no space for the diaphragm to flatten downwards. So the ribs are going to be expanding out, your lung capacity is decreased. So you know our whole thought of take that lovely deep breath in and a long exhale is going to be definitely minimized on pregnant women, especially in the third trimester, because remember the third trimester is where baby puts on all the weight and does a massive amount of growing. So use as many props and supports as you need to help people accommodate breathing as they go through their movement class. So guys, here are a few props that we might use. So this is just like a wedge-shaped cushion, okay? So it's literally, there's high density foam inside and we've covered it with vinyl so that it's easy to clean. And this is quite lovely for women just to be able to relax back on. So they have their head lifted, they can get their lower back nice and comfortable, maybe they just put a towel here, maybe they want to slouch down and rest their heads. But it's quite a lovely way to be able to get them into a position where they can just breathe a little bit with ease. Okay, so this is quite a lovely prop to use. And I think we got these at a place called the Foam Factory, which is down on Lansdowne Road. And then all they do is create a big block of foam. They cut it on a diagonal, so you get two wedges out of a block of foam. And then we have one of these props for each of the women that comes into our classes. Okay? And again, go back to the idea that this course is great work and modifications for anybody that maybe has issues with moving, okay? So mobility issues, maybe slightly overweight, maybe an older client, maybe somebody with back injuries. Quite frankly, these are just like nice props to have regardless. Okay, and then the other prop that I love to use when we're teaching breathing as well is to have a large bowl. And you know, not everybody has access to a large bowl, so you know, you don't have to have it, but it's quite a nice prop because you can also deflate it. So you know, in first trimester, second trimester, you know, you can have women lie over the bowl this way. It's such a lovely way to relax. And then focusing on the breath here, when baby gets really big, all you do is deflate the ball a little bit, so that when you lie against it, you actually have almost like a little bit of space for baby to rest into the ball. So you don't have to keep the ball blown up really hard like this as well. So again, using the props that you have around you. The other one is being able to use a TheraBand. You know, and as soon as you take that TheraBand and you can wrap it around mom's ribs around the back, and it just gives her a nice tactile cue, a nice awareness of the rib cage expanding in and out as you breathe. So you can get creative with any of the props that you want to use. Guys, any other ideas? Like what other props could you use for breath work? I find as sorry, Bernie, were you about to say something?
No, I wasn't, sorry.
You're leaning closer. Okay, yeah. So the other thing that's really nice to have is a soft blanket. And then if you fold the blanket, and provided that you're sort of in the first or the second trimester or even postnatally, that you can literally just lie on your back. And it's quite nice to put the blanket under the pelvis because it brings the pelvis into a little bit of a posterior tilt, which releases the back. You could maybe turn the blanket lengthways so that you're lying along it. It gives you lovely tactile cues for your spine. You could fold the blanket, put it under the head so the head is a little bit supported, the head and shoulders. So, I mean, lots of different positions, and again, depending on which trimester you're in, you can make the modifications that you need as well. And that's something that we're going to be talking about is as we go through the repertoire, how do we modify this or make it appropriate for first, second, third trimester, and postnatally as well. So we're going to look at that too. Cool.
Mm-hmm.
Yeah.
One thing is that the lady that was in my class found that it was much easier to breathe when she was lying on her side rather than on her back. And the other position that she really liked was to put her legs up against the wall. So it's the legs up position, Viparita Karani, but then actually right with her tailbone against the wall and legs up. And she thought that was really comfortable, very supportive.
Yeah, absolutely. So that's a really, really nice way just to take all the pressure out of the lower back as well. So for some people, so then obviously she must be relatively flexible to have her legs straight up the wall. So a lot of people that aren't that flexible, even just lying like this, with your knees bent, and that you're just supported, or if you don't have a wall, you just put your feet onto a chair or onto a stool. And what it does is it softens and releases the iliopsoas, which is your hip flexor muscle that connects into the lumbar spine. And it is such a lovely release for the lower back. So, and in fact, we're going to be doing that in our repertoire as part of this course as well. Cool. All right, so we're going to start taking a look at some rules of thumbs for modifications, because now we want to start tackling a little bit of repertoire so you guys have something to work with over the weekend, okay? So some general ways that you can modify exercises is you can take a narrower stance. So in particular, this is for standing postures and standing positions. So as soon as you actually bring the feet closer together and it's a narrower stance, it allows you to stabilize across the pelvis a little bit more. In some instances, taking a wider stance, so doing things like the roll down, doing mountain pose, which is just basically standing upright, doing downward facing dog, etc. So the differences being that if you were going to do a modification to help people with balance, then if you're standing either with the feet together or hip distance apart, then that's a little bit of a narrower base. And now if your belly is out here, your third trimester, you're feeling just a little bit wobbly, then maybe taking your feet slightly wider, softening the knees, that wide base is much more stable, right? Then you feel like you're a little bit more solid. So that's a common modification that we might do. On the other hand, when we go into something, and you guys are going to be learning this, if we went into something called Warrior 2, which looks like this, which looks like this, that's like quite a strong pull around the pubic bone and the sacroiliac joints. And remember in third trimester, that you've got relaxin, the hormone coming through your body that's kind of like loosening everything up. This might be too much. So now we narrow the stance. And that is Warrior 2 in third trimester. Okay, you're still getting all the benefits of it, but now you're starting to contain the movement to make it more appropriate. Everyone good with that? All right, so having as many props available to you on hand as possible. And the thing is now, with a lot of us teaching on Zoom, so you might be talking your clients through a class, they're at their house, you're at your house, you don't know what equipment they have. You will be amazed if you walk around your house at the props that you can make use of. So you might not have one of these wedge cushions. So you know what? Take 3 pillows off your bed and you have a wedge cushion for yourself. All right? You may not have a large ball, but that's fine. Take your dining room chair and you can use your chair instead. You may not have a foam roller. Doesn't matter. Take a blanket, roll it up, and there's your foam roller. So and you might not have one of those straps, like a cotton strap for any kind of support or stretching, that sort of thing. You take a belt, or you take the belt of your dressing gown, and there's the strap for you to use. So you can make use of what's available in your client's house, and you can make a plan. All right, so another common modification that we do is when you are seated, a lot of people, and especially with the belly in the way, start to take strain around the lower back and the hips. So sitting up on a support or a bolster, or you could even sit in a chair, would be a great way to get you out of the hips. And the other thing is, make space for baby. Take your legs apart. You know, it's quite difficult sitting with your legs close together, and then, you know, baby's resting on your thighs. All right, so then you take your legs apart and you make a little bit of space. You want to keep stretches and movements gentle. You know, so this is also quite difficult as well. If you've got women who are a little bit more of an A-type personality, okay, so they're used to working hard and they want to see results. You get a lot of women, I mean, they've got fantastic bodies, and going through pregnancy can be quite distressing for them because they're losing their figure, they're losing their shape, their body is changing, and they don't know what it's going to look like again afterwards. You know, so it's quite difficult sometimes with certain clients to really get them to step back and just be gentle with themselves during this whole process as well. You know, and again, just going back to my personal experience, I said to you, I had an incredibly easy pregnancy. It was fabulous. I loved being pregnant. But I also know that I pushed myself quite hard when maybe I could have been stepping back a little bit. And it wasn't that I consciously pushed myself and thought, yeah, I'm going to get a workout. It's just that I thought, no, I'm fine. You know, my body feels actually quite normal and strong, you know, and then in hindsight, I was just like, what was I thinking? You know, I should have been stepping back a little bit. So I think it's actually quite nice as movement practitioners and teachers that we keep giving people permission to do that. You know, it can be part of what we do, is encourage them to do that. All right, so as a general rule, you don't want to hold any position for longer than about 20 to 30 seconds. And then give people permission to move out of an exercise or out of a stretch or out of a pose whenever it feels right for them. So you might be like have 3 people, like Maya had 3 people in the class with her the other day, you know, so she might be there doing a stretch, and then somebody's going, I've had enough. Fantastic. When you've had enough, just come out of it. That's absolutely fine. Other people might be there for the full 30 seconds. So everybody is different. With high blood pressure, okay, you don't want to take the arms overhead. And the reason being is that as soon as you bring your arms up overhead, it's going to actually increase blood pressure. So any of these movements where your arms come up overhead, or any of the movements where you're actually making fists, okay? So you don't want to hold fists because that's also going to skyrocket blood pressure. So always easy fingertips, and then bring the arms down. Bring your hands in front of your heart. Place hands on baby. Take arms to the side. So have modifications for the arm positions if anybody is struggling with blood pressure. And guys, that's as a general rule, not just for during pregnancy or those modifications. And then, most importantly, take a break whenever you need to, okay? Especially in a group class. Some women might not feel that it's okay to stop because everybody else is going. So you just keep encourage people to take breaks when they need. Any questions on those general rules of thumb for modifications? All okay?
Yeah.
Awesome. So guys, we're going to start going into a little bit of repertoire now, okay? And the first exercise we're going to take a look at is called the roll down, okay? So you'll see we put a little picture in here. So those of you that have been to the studio, you might have met Annie. So Annie was at the front desk for many, many years, and then she left last year. So she was our model for this. And we've had a few people who went, oh my goodness, is that Annie? I didn't even know that she was pregnant. Well, she wasn't. That's one of those little overballs that we stuck underneath her shirt. So I just kind of thought I'd better nip any rumors in the bud before they get out there. So she had a little overball underneath her shirt. So, you know, the other thing that I would like you guys to try, if you do have an overball, it's quite a nice way when you guys are practicing this. You take the ball, put it underneath your shirt, and then you can start rumors of your own, right? Start posting pictures of yourself on social media, all right? But what it does is it gives you a real sense of what's it like to do that movement. What's it like to try and get down on the floor when this is here, you know? Because otherwise you can imagine it, okay? But when you start thinking about a woman in her 3rd trimester, get a little ball, stick it under your shirt, and then see what it's like to transition from one position to the next, okay? You'll very quickly realize that you can roll over to do cobra. It's not happening, right? There's no cobra with this, okay? So if you guys do have one, or if you just take like a pillow off your couch and put it under your shirt whenever you're practicing something for the 3rd trimester, it's actually quite fun to do it as well. Okay, guys, so with the roll down here, it's really about mobilizing the spine, warming up the back line of the body, so it can also be for the hamstrings as well. We're looking at this in 3rd trimester, and can you see that Annie is standing with her back against the wall? Why would she have her back against the wall? What's the advantage of that?
For your balance?
Absolutely. So having a non-moving, stable surface behind you for support is so important. And don't forget, if you've got any kind of blood pressure issues happening, which most people are going into low blood pressure, they might feel a little bit wonky. So having that wall behind them for support is great. Can you see as well that we've taken her feet a little bit wider apart? So that again is about creating a stable base. Can you see that she didn't roll down very far? And that's partly because baby's going to be in the way, okay? And also, she might not be able to go further than that because it could be putting quite a bit of strain onto her sacroiliac joints and lower back. So in 3rd trimester, those are the common modifications that we would use for this exercise. This is a really, really lovely exercise as well, just to get people to start a class or maybe to finish a class, because it really just gets you to pause for a moment. Oftentimes I get women to just close their eyes as they're standing there, just to be able to feel what's happening with their body, feel a little connection to baby, and maybe you can do your pelvic floor work here while you're standing so that you're starting to feel the connections into those stabilizers as well. So guys, let's try this all together. So just make sure that you've got a little bit of clear wall space for yourself. And I'm going to angle my camera a little bit this way so you can see that wall there. And if you do have a cushion or a ball, please take it and put it underneath your shirt so that you guys can get a sense of what it feels like to do this roll down with a baby in the trimester, okay? So I'm just going to put my hand under the pink top there. And so first of all, just have your feet far enough away from the wall that you really feel that you can relax back into the wall. If you have your feet too close, it might actually feel like you want to topple forward, right? So just allow yourself to give your body weight. Now here's the other thing. Just on the safety side, if you are on a slippery surface, You want to make sure that women have non-slip shoes on, like maybe even running shoes if they're on a slippery surface, or you put a non-slip mat underneath their feet, just for safety's sake. Take your feet wider apart than you normally would, so you feel very stable. And then feel the weight of your sacrum against the wall. Feel the back of your ribs against the wall, and then lengthen up through the back of the neck. Now, your head may or may not be touching the wall. If you feel like you're forcing your head back against the wall and creating strain, please don't do that. Just create length up through the back of the neck and let your head settle where it feels that it needs to. Just let your arms hang nice and heavy. Close your eyes for a moment. Soften your knees gently. And we're just going to take 3 breaths in and out here. So I'm going to inhale through my nose and exhale through my mouth. You can change the breathing if you wish. And again, breathing in through your nose. Breathing out through your mouth. And just one more time, breathing in. And breathing out. And then just allow your eyes to blink open. We're going to inhale, create a little bit of space for yourself. And then on your breath out, look down. And just allow your shoulders and your upper back to peel away from the wall. And you may want to stay there for a moment. Maybe you feel that there's a lovely imprint of your lower back to the wall, then you might want to stay there. Otherwise, you can continue rolling forward. Keep your pelvis pressed against the wall. And just come forward until your hands are in line with your knees. We don't have to go any further than that. Take a breath in across the back of your ribs. And then breathe out as you come back up. And I want you to give baby a hug as you come back up. Use your abdominals to hug baby. Feel your spine coming all the way up and lifting nice and tall. And again, inhale, create some space. Exhale, look down. And then just start peeling forward. And you can decide how far you feel that you want to go. Keep your pelvis anchored to the wall. Make sure that your knees are soft and that you're rooting into your feet. Relax the back of your neck. Take a breath. And exhale. Give baby a hug. Use your abdominals to support yourself as you come all the way back up. And lifting nice and tall. All right. So guys, let's come make some notes. How did you guys feel with that?
Good.
All good? Okay, hold on a second. Little question here.
You can see how the weight of the tummy will put that pressure on that lower spine, even against the wall. So she's got to really take it nice and slow.
Absolutely. Yeah. Absolutely. So there's no rushing. And that's also why when you take the feet wider apart, that you actually create some more space for the sacrum to sort of sit between the 2 pelvic bones, one on the right and one on the left. So that's also quite nice to create a little bit more ease through the lower back of the pelvis as well. So Grace is saying here, would you consider a seated roll down or a cat-cow? Absolutely. So you can definitely have this either sitting on a ball. Now the ball again is a little bit unstable, but what you can do as well is take the ball and wedge the ball against the wall, because then that just makes sure that this isn't going to move around as you do your seated roll down. And again, you want to have the knees wide enough apart that baby has space to come through, or just sit on like a dining room chair, something that's more stable than that as well. And we will be going into the cat-cow. We're going to talk about modifications that you might do there for the cat-cow, or some people might call it the full cat stretch. Okay. Awesome, guys. So how would you, if you have a class with 4 different ladies, and 2 of them are in their 2nd trimester and 2 of them are in their 3rd trimester. So now you know that for the 3rd trimester, we've just done the roll down there. How might you possibly teach this to women in the 2nd trimester? You could have all of them doing the same thing, by the way, absolutely fine. But what could you do to make it a little bit more challenging for women in their 2nd trimester? Any ideas?
Without using the wall, so they just stand in away from the wall.
Absolutely. So you could actually offer them the possibility of just step away from the wall, because then they might be able to roll further down. Yeah, so baby in 2nd trimester, you're getting a tiny little tummy, but it's nothing hectic. So they might actually have more range of movement, and then you can step them away from the wall to accommodate that range. Awesome. Cool. Any other ideas of what you could do? You don't necessarily need to have the feet so wide apart. You could actually still have them with their feet hip distance apart, maybe. Okay. Cool. So let's move on to our next exercise. And this is our side stretch. So again, this is an exercise that I'll do up against the wall, and there are lots of different ways that we can modify this. So guys, the simple fact of lifting the arm overhead for some people is already like quite a serious stretch, because if you think about your ribs have expanded, your abdominals are in a stretched position already. When you bring the arm overhead, that's already putting a bit of a stretch. And then you can do a lean to the side is going to give you a little bit of an additional stretch as well. So this is lateral flexion of the spine. And again, it's such a lovely way to create space along the side body, to mobilize the spine, to activate the all those muscles around the ribs, like the intercostal muscles, the diaphragm, the obliques, for example. Okay, so let's go through it again, and let's do it with the ball so that we can actually get a sense of 3rd trimester of how we might be able to offer some modifications here as well. So I'm going to be up against the wall, so you guys can join me. And if you're working with women on Zoom and they're at their house, if they don't have an open wall space, you can do this against a door, provided that the door isn't going to suddenly get forced open, or you can do it against like some bedroom cupboards. A lot of people have built-in bedroom cupboards, and then you can just stand against the cupboard. All right, guys, so bring yourself into the same position that you were when we did the roll down. And now what I'd like you to do is to take your hands and place them back against the wall. So you're using your arms as a little bit of a stabilizer. Soften your knees and really anchor your pelvis against the wall. Now here's what we're going to do to start off with. Start leaning towards the left so that you are sliding your spine over to the side, and you're getting a little bit of a stretch up the right side of the body. And then exhale, give baby a little hug as you come back to the center. Now lean towards the right, so you're opening up the left side body. And then exhale, give baby a little bit of a hug, and you draw back to the center. I'm just going to change the angle of my camera a little bit so you can see me a little bit more clearly. I think that's better. And now let's do that one more time. So we're going to lean to the side, and this exercise with both arms down, come back to the center, is called windscreen wipers. One more time. Inhale, reach over, laterally flexing the spine, and draw back to the center. Now, we can progress that by taking one arm overhead. So keep your left arm on the wall. Reach the right arm up. Bring it overhead. It doesn't have to stay on the wall, especially if the shoulders are tight. And now, lean towards the left. And can you feel with that right arm overhead that it's increased the tension in here? Exhale, come back to the center. And bringing your arm all the way down. Right arm stays. Left arm comes up. And lean into the side, getting that wonderful opening along the left side body, and exhale, pull back up, and then bringing the arm all the way down. Good, and then you can come all the way up, and let's have a little bit of a chat. So, guys, for us, and not in third trimester, this is a really easy movement for us, right? Any kind of lateral flexion of the spine, it feels like a lovely stretch. It feels like you're mobilizing the thoracic spine and the rib cage. In third trimester, we've already spoken about the ribs are out, because the diaphragm is getting pushed up, and if you're breathing, you have to have that wide expansion of the rib cage. So think about all of those muscles that attach to the ribs that are getting stretched. It's going to be the diaphragm. It's going to be all of those intercostal muscles that line the ribs, okay? It's going to be all of those muscles that attach to the ribs. At the front, it's the abdominals. At the side, it's the obliques. And at the back, it's going to be things like your quadratus lumborum, right at the back. So that movement to the side is going to feel like a really strong stretch because they're already stretched. And then when you pull back to the center, it's going to be really hard work. So a lot of women in their third trimester find that like quite a strong workout for the abdominals. Okay, we take it for granted that we can do it, but that's like a nice workout for them. So if we take a look at that exercise, I gave you guys the option of having your arms down. That's kind of how I teach it to people on their first time. And then, if that feels okay, we give them the option of the arm overhead, because that arm overhead really increases the tensioning along that lateral line of the body. So that might be a little bit too much, and then you want to give them the choice. So what other ways in third trimester do you think you could teach lateral flexion to your clients? Any other ideas?
Sitting on the ball again.
Fabulous. So again, if you're sitting on the ball, I would probably make sure that it's pushed up against the wall so it's not going to move. But then what you're doing is in a seated position over to the side, dining chair, fantastic. And I think, Maya, you're saying seated. We've just spoken about that, but you could also be seated on the floor, okay, sitting on a bolster cushion, or lying down is fantastic as well. So there's a posture in yoga called banana asana, okay, so it's making a banana shape on the floor basically, okay? So you can either have your legs stretched out long. If that's too much for a lady in that third trimester, you can have your knees bent and then just reaching your arms up overhead as well, okay? So making like a banana pose. Awesome. Okay, and then if you wanted to make it appropriate for somebody who's in their first or their second trimester in the class, what could you do? So you could make it more challenging. Yeah, Bernie?
Couldn't they just go back to the feet to slightly, obviously closer together, no wall, no support structure, and just from there continue forward?
Absolutely. Absolutely. So, I mean, that's essentially what I teach in my regular Pilates classes, is that you are literally just standing and reach up and over and come back to the center. Okay. So you can do it standing freely, so people are going to have more range of movement. It's just as soon as you put people back against the wall, it's just going to offer them that little bit of extra support. Okay, fantastic. Yeah, Bernie.
Sorry, one question. I just wanted to just verify. For pregnant ladies on their backs in their third trimester, does that not make things very uncomfortable for them though? So
absolutely. Yeah, absolutely.
What stage do we keep them off their backs?
Okay, so you don't have to keep them off their backs completely at any point during pregnancy. However, there are modifications. So in fact, this is a good chance for us to take a look at this. Let me backtrack a little bit here. Oh my goodness, where is it? Right here. Okay, so this is in your manual on page 8, okay? And we have different exercise modifications during pregnancy, okay? So guys, remember as well that every single pregnancy and every day in pregnancy is different for each woman. So you know what works for one person may not work for someone else. As a general rule, in the first trimester, it's just having that awareness of morning sickness. So most moms carry lots of snacks with them. So especially if you've got morning sickness, things like crackers, water crackers, green apples, those are favorites that women have, okay? And to also drink soothing teas, all right? So having sort of herbal teas can also be quite soothing for morning sickness. Avoiding any kind of overheating at this time, because your pregnancy is being established. We spoke about it before. This is when baby's vital organs are being formed. So definitely anything that increases your body temperature isn't great. So things like hot yoga wouldn't be advised. And then also breasts can become very tender during this time as well. So offering variations from lying prone is really important. So you'll see when we go through our repertoire and we start looking at things like back extension, we're going to look at variations for that. In second trimester, when you're lying supine, having mom's head supported is quite nice. It's going to keep her head above her heart. Lying supine for long periods of time, in other words, we're talking more than 5 minutes, can actually stop the venous blood return to the mother's heart, okay? So the weight of baby can start to compress what is called the vena cava, okay? That's the blood supply. So mom can start to experience dizziness because of the decreased blood supply to her heart. So in other words, you may not eliminate lying on the back. You might just start to minimize the time period and also making sure that mom's heart, her head is supported, that her head is above the level of her heart. And then providing support with a large ball or underneath a chair, or making sure the feet are completely supported so that you're not doing what is called open chain work. Open chain work is when you've got both feet lifted, both hands lifted. Any kind of full inversion, like a headstand or a handstand or a jackknife or a rollover, all of those are going to be avoided now. Any kind of intense stretching. So gentle stretching is great, but any kind of intense stretching, thinking I'm going to increase my flexibility, we start to avoid. And then obviously again, strengthening the back muscles in other positions besides lying on your stomach. And then also, you don't want to have prolonged periods of standing motionless, because you can start to get pooling of the blood in the lower legs. So again, we're going to talk about some very specific exercises that you can do which increase circulation. So guys, you've got this like huge piece of connective tissue over the calf muscle that is responsible for pumping blood back to the heart. And we're going to look at some exercises for that. And then obviously when you're doing anything where you're kind of working on balance, you want to make sure that there's like some kind of support or balance close by. So having a wall, having a ballet bar, having the back of a couch, having a table or a chair that you can hold onto for balance as well. And then third trimester is obviously when you're going to have the most modifications. And that is when you're going to give mom a wedge, like we looked at, or something called a C cushion. That's the sort of rounded cushion to lie in when you're lying supine. Having a pillow or a towel when you're lying on your side to put under baby bump so that you feel baby's lying supported instead of just lying on the mat next to you. And then also if you're working your feet, so you don't want to point the feet too hard because those calf muscles can cramp. And again, that's related to that connective tissue around the calf muscle. Avoiding any kind of strong downward pressure on the pelvic floor. And we spoke about this on Tuesday when we spoke about hemorrhoids, or, you know, that basically is a varicose vein that happens to be through the rectum and through the anus. And that if you have any kind of strong downward pressure on the pelvic floor, it can cause irritation if someone is prone to hemorrhoids. And then supporting the abdominals with hands or towel to minimize any kind of separation of the abdominals, which is that diastasis recti. So, you know, these are things that as we go through the repertoire that we've been looking at now, we're going to start to tie them back to kind of see, okay, well, why are we doing this modification? Why are we offering this particular support right here in this exercise? And it ties back to those principles or those issues that could be arising in the different trimesters. Okay, so Bernie, we're going to come back to that when we get to an exercise where we're lying on our backs, of what support are we offering, when and why. And it's also going to tie back to what Grace was asking about with that separation of the abdominals. When do we modify, why and how? Cool. Makes sense, guys?
Yeah, thank you.
Awesome. So we're going to dive into one more exercise for today. All right, so we've done our roll down, we did our side stretch. And then right here on page 17, this is a chair pose, okay? Or we could actually simply call it a squat, because at a certain point, you don't want to stay motionless in a certain pose. We just spoke about that right now. We don't want to have any kind of blood pooling. So we're going to go through this exercise now, and we're going to do some different modifications and then discuss why we are doing those modifications. So guys, let's come back up against the wall, and you're welcome to pop the ball or the cushion underneath your shirt again, so that you can feel what it's like to have baby there. And I'm just going to angle my camera so you can see. So standing with our backs against the wall, you're going to have knees and feet separated wide enough that you feel stable on your feet. And then what we're going to do today is place hands just on the pelvic bones underneath baby and find a little bit of length up through the spine. So all we're going to do is start to bend the knees so that you slide your back down the wall. And then you're going to start to straighten your knees and slide your back up the wall again. Now, as you bend your knees, you want to make sure that your knees are tracking straight forward over the second toes. Don't let your knees collapse together. So this is great for strengthening the quadriceps. And then we're going to straighten the legs and slide up. If you feel that you're getting stuck on the wall, guys, this is where it's quite nice to take that large wall behind your back, or you can even just put a towel behind the person's body. Now, let's do a little bit of a modification here. I want you to put your hands under baby so that you feel that you're offering some support from underneath. Now, let's make sure that we're breathing. So we're going to inhale to bend the knees. And then on your exhale, straighten your legs and feel the pelvic floor connecting, the abdominals connecting, and you feel extra support underneath baby here. And we go again. Inhale, bending the knees. And then exhale, rooting into your feet, giving baby a lovely hug and a lift. And now we're going to do one more time. We're going to bend the knees and we're going to stay right here. So now make sure that you're breathing. You never want to do a breath hold. You want to make sure that you've got oxygen flowing. Use every exhale to connect into those abdominals. And then if you feel, ooh, okay, this is enough time of staying still, why don't you add a little challenge of lifting one heel and place it down, lifting the other heel, placing it down. If that still feels like it's too much, you give your clients permission to come up out of it at any point that they need. One more time, lifting the heel, placing it down, take a breath in, exhale, give baby a lovely hug, and you slide yourself back up the wall. Okay, so let's come and have a little bit of a discussion. So again, I see no reason not to put something like that into any Pilates or yoga class. If you think about yoga, you guys know the chair pose. So for those of you that don't come from a yoga background, chair pose looks like this. Okay. But that can obviously be very intense in third trimester. Now all of a sudden you're having to use those abdominals big time. You might feel like your balance is off. So we modify that chair pose by moving ourselves back against the wall. Some people don't call it chair pose. We simply call it squats. So you're simply bending and straightening the knees. And then you can add all kinds of variations there to make it easier, to make it a little bit more challenging. You can hold that bent knee position. You can go quite deep if you're feeling pretty strong. You can do a micro bend of the knees, especially if you've got knee issues as well. So it's about keeping the strength in your legs as well. All right, and that tracking of the knees. How did it feel for you guys? I mean, obviously none of us are 3 months, third trimester pregnant, but when you put your hands underneath baby, could you get a sense of that connection to the pelvic floor and the lower abs? It's quite amazing, isn't it? You know, because you can actually, I mean, with the ball there, and then when I exhale, I can almost feel the ball getting sucked in a little bit. And it just tells you immediately that those lower abs on the front pelvic floor are in fact working and doing their job. And that's so closely related to your breath as well. So the breathing is incredibly important. Okay. Guys, any questions on that? Is it all good? Fantastic. So homework to leave you with over the weekend is to read through those exercises again. Take an opportunity, if you can, to teach the exercises to someone else. And whether or not they are pregnant or postnatal, or whether or not you get them to put a little ball in, or you could actually just teach it to them on their body, you know? So whatever's happening with them, just give yourself an opportunity to figure out the cues that work for you, how you would teach it, and take a look at some modifications on the body that you're working with. What could you possibly modify to make it easier or to make it a little bit more challenging as well? Okay. Are we all good? Fabulous. So then what we're going to do on Tuesday is we're going to take a look at perhaps some complications that might arise during pregnancy. So we're going to take a look at what is a breech pregnancy, what happens with delivery there, and possibly some contraindications with some of these exercises if a woman is breech, and how we might need to modify for her as well. And we'll continue working through the repertoire. And then we're going to start talking about what's happening with that separation of the abdominal muscles, because there are a lot of modifications that we've got to bring into the work with that. Okay. Fantastic, guys. Have an amazing weekend. Can you believe that it's Friday? Time is flying, hey?
I believe it's August.
That's crazy, hey? And for those of you that are in Cape Town,